Well, thank you, Dr. Gokhale, for the warm introduction. And I'm honored to share the stage with Minister Dr. Singh, Minister Dr. Puvara, and Dr. Sharma, and all the other distinguished panelists as well. It's been almost 7 years since I was last here in India. Far too long, I can tell you that. And I'm so glad to be back. During my last visit I was here, I spoke with finance ministers who were in Delhi for a meeting of the International Monetary Fund. And I said that when women experiencing poverty are able to control their own finances, it can lift up not just them and their families, but whole countries. Now, what could be more worthwhile than that? Even then, India was far ahead of the game, and you continue to show the world exactly what investing in women can do. Early in the pandemic, the government used digital bank accounts to send cash to 300 million people, including 200 million women, which protected them and their families against the worst shocks of the COVID economic crisis. Now, what I can say, though, is too often women don't have control over their own money. But when they have direct access to funds through digital bank accounts, it's easier for them to save and get credit and get insurance and all the important steps then that they can take towards getting women into the labor force and raising the economic productivity of the country. From my point of view, making sure that cash transfers get directly into women's hands is a textbook example of what we call gender intentional policymaking. And it shows how to best respond to the needs of society's most vulnerable women. And that is what India has been doing over the past few years, building a more gender equal country, literally from the bottom up. So it's only fitting that groups like Women Lift Health are asking what the next logical question, of course, is. What about working from the top down? Policies like emergency cash transfers may benefit women, but who's designing those policies in the first place? In all sorts of institutions, governments, businesses, family, the face of power still often belongs to a man. And that's true in almost any country and every sector around the world. But it's especially true in health. Women are the backbone of every healthcare system in the world. They're the nurses, they're the aides, they're the community health workers, and they're providing everything from neonatal care all the way to cancer care. And in India, it's the women health workers who were the heroes of the pandemic. They were getting people immunized and going door to door to test for COVID and arrange treatment. And yet, 83% of the doctors in this country are men. And who runs the hospitals? Who runs the research labs? Who makes the decisions about policy and priorities and budgets? Men. And that's the case worldwide. Women make up 75% of the global health workforce, but they're only 25% of the senior leaders worldwide. So the lack of women at the top has implications for every single corner of the health system, from who participates in vaccine trials to how much funding goes towards diseases that primarily impact women. So decisions can't only be made for women, they have to be made by women. It's not just that women are more likely to promote the welfare of other women. It's that when women are involved in decision making, the decisions they make are better for society as a whole. When I was writing the book that was referenced earlier, The Moment of Lift, my book about women's empowerment, I came across a study. It showed that groups that include at least one woman, just one, outperform all male groups when it comes to collective intelligence tests. Now, of course, gender equality doesn't mean just putting a woman, one woman on a corporate board or a government committee, no matter what her qualifications are. It means making sure that women have the opportunities to show that they are qualified, that they bring uniquely valuable contributions that can't be found in a room filled just with men. Now, often this is made possible by women opening doors for other women. When Dr. Manju Sharma became the first woman secretary of India's Department of Biotechnology back in 1996, she was just getting started. She played a significant role in establishing the scientific institutions across many disciplines, as we've heard, from plant genomics to DNA fingerprinting. And her example paved the way for so many other women in science. And of course, before doors can be opened to women, they have to be open for young girls. The Mumbai neuroscientist Vidya Vida makes a point of going to schools and science camps to explain her research. So it wasn't surprising that when she won the Infosys Science Prize of the Year for her research on mood disorders, she said she plans to use part of her prize money on science and math education for girls. Yesterday, I met with the minister, Irani, and dozens of impressive women who are government officials here, and I learned about some other ways that the seeds of gender equality are being planted in India. It was so encouraging to see how committed they all are to enabling growth pathways for women. So India's made great progress towards designing a government and health sector that serve women well. Now my hope is that India will go even further and make sure that policies aren't just designed for women, but by them. It's going to require advocates like those in the union ministries, the Department of Biotechnology, and Women Lift Health to keep building leadership opportunities and support networks for women in health. It's going to take government and businesses and NGOs to make sure that they include women in their leadership ranks. And it's going to require society, all of us, to value women's work, women's ideas, and women's power. Doing so won't just celebrate a few notable women who deserve fanfare. It will show the rising generation of women and leaders around the globe what's possible. And it will prove that when given the opportunity, women can be so much more than afterthoughts in a broken world. They can and should be the architects of a better one. Thank you.